Welcome, everyone. This is Three Bone Theater with a talk back for our current May 2022 production of Dot by Colman Domingo. In this particular show, we are joining the Sheely family as they navigate some difficult conversations over the holidays. And today we have some special guests to talk about the themes of the show and some follow-up discussions if any of these themes resonate with you in your community. So I'm going to allow each participant to introduce themselves and tell you a little bit about what they do, and then we will dive right into the questions. I'm going to start with our artistic director, Robin.
Hi, I'm Robin Tynes-Miller. I'm the artistic and operations director at Three Bone Theater and co-founder, and I'm so pleased to be with you all today and excited to talk about the show.
Thank you, Robin. I'm going to go to Sonja. Oh, we lost you, Sonja. Hold on.
Hello, I'm Sonja Lee. I'm the executive director and founder of the Lionel Lee Jr. Center for Wellness, and we are very pleased this year to be community partners with Three Bone Theater.
Fantastic. Thank you, Sonja. And Dr. Logan. One second, we got you muted.
Okay, I'm a psychiatrist in the community and a sometimes actor, as Robin knows. I have been on the Three Bone stage before. Some of you may recognize. I currently practice at the VA full-time, and I have a part-time private practice as well, Mid-Carolina Psychiatry. My training, just very briefly, I did my medical training at George Washington University in DC, and then I got a residency in Georgetown University. So
thank you. I appreciate you all being here and leading some of the conversation post-show. This particular show has a few themes we deal with. Alzheimer's, there's mention of dementia briefly, and in a moment we'll go into the differences of what they are. There is the theme of holding on to memories. There are family dynamics, sibling dynamics, how to navigate transitioning relationships from parent-child or sibling to caregiving relationships. And there is also more than one character dealing with a little bit of a mental struggle around what's happening in this show. So I wanted to talk a little bit about how this show came onto the Three Bone plate and what, when reading the show, Robin, what about this show stood out and made you want to include this in your 10th season?
Yeah, so we read probably between 50 and 60 different shows every year to pick the 4 that we're going to produce. And so some of the things we're looking at are excellent writing, opportunity for lots of different people of different backgrounds, you know, race, gender, ability, all sorts of things to be able to participate on the stage and in creative teams. And I think we just fell in love with how Colman Domingo writes about this family in such a relatable way. The characters are messy and imperfect and make lots of complicated choices and have complicated relationships with each other. And that's something that we just really love in our work, because I feel like that, you know, that is kind of the essence, the yumminess of contemporary theater that we really enjoy. And so we felt like it was going to just be a wonderful story for the community. You know, it hadn't been done here before, and to be able to bring this story to the stage was just a really exciting opportunity.
Fantastic. I do love that all of what's happening is real life, right? These are characters we can relate to. This is a family dynamic we can relate to, and it's done in a way that, depending on where you are in life, there's no right answer. Maybe sometimes you can see yourself in different characters, but that is a beautiful thing to bring to stage. I want to take a moment because our main character is fighting really hard to hold on to her memories because of her Alzheimer diagnosis. And there's a brief moment where someone says dementia, but then we finish the rest of the script talking about Alzheimer's. So Dr. Logan, I'd love for you to explain to our audience the difference difference between the two diagnoses?
Sure. A lot of people sort of get that sort of confused or mixed up. And a lot of times it's used in the vernacular as well. So people, joke about the meaning in that. So I'm glad, first of all, I'm glad to be here. Thank you, Three Bones, for inviting me to participate in this talk. And I also want to thank Three Bones, before we get into anything, for bringing this play to Charlotte. It was just an absolutely wonderful production. I have worked with several families who have been going through these struggles in my almost 30 years in practice. And it was a very accurate, poignant depiction of some of the issues that these families face. So it is my pleasure to sort of participate in this talk back. So we thought it would be good to sort of define the terms that we're talking about a little bit more clearly. And dementia means simply a loss of memory, usually associated with behavioral dysregulation and cognitive decline in general, okay? It usually progresses over time. The patterns of progression are different depending on the type of dementia, okay? So dementia, if you will, is the general rubric. And then there are many things that can cause dementia. One being Alzheimer's, another being Parkinson's disease. You can have what's called frontotemporal lobe, dementia. You can have dementias related to Lewy body disorder. And each of the different types of dementia present slightly different. And the progression of them, we tease them out by the progression of the illness, basically. So it's understandable why there would be so much confusion. Also, there's a class of dementia people may not know that everyone thinks that it's irreversible illness, but there are even reversible dementias. A lot of people don't realize, but when they're suffering from depression, if any of you have suffered from depression before, you have that fogginess, that cognitive delay, that feeling of being overwhelmed, not being able to process as you normally would. And we used to call that pseudo-dementia, meaning false dementia, false problem with memory. But in the psychiatric community, we don't really say that anymore because we realize it's a very real dementia that reverses once the depression is treated. Also, there is something called normopressure hydrocephalus, and all that big name means is that fluid builds up on the brain, compressing the brain matter. And that can obviously cause a number of impairments, one being dementia. And if it's caught early enough, and it's treated early enough, that's another reversible dementia where you can see dramatic improvement just like that. Like they walk into the office demented and they walk out completely back to themselves pretty much a lot of times. So that's why it's important to distinguish what we're talking about here, because they each present differently and they each can have different courses.
Thank you. I learned something. I didn't know there was reversible dementia ever. And if what I'm hearing clearly, dementia is kind of the umbrella in which a lot of things fall under, Alzheimer being one of those, right?
Yeah.
Awesome. Listen, I love a good talk back, guys, because I'm learning as much as you're learning when we do this. So you brought up you brought up depression and some of the effects. So I wanted to ask this really quickly before I transition to the other speakers, but there are a few family members who seem to be battling a few, we see an anxiety attack happen in the show. We see how certain people are navigating the changes and how it's affecting their mental health. So if you were a person in this family unit, what are some tips you would give to people and how they handle these kind of big battles with their mental health?
Great question. One of the things that the play depicted, I thought extremely well, were there were two things that I really thought were very, salient in terms of understanding what a person is going through with dementia. The first thing is that there were people attributed things to the person who was dementing that they eventually realized through the evolution of the play were not so. Like, I think there were a couple of lines where they imply that she's doing certain things on purpose, or she's doing certain things just to act out, and she knows what she's doing. And, and dementia can be very, very confusing that way. Because, in the morning time, they could be just as clear as anything. And then usually towards the evening, oftentimes, you probably have heard about sundowning, they could become agitated. So it's very confusing because a minute they're there, especially in the early stages, and then they're not there, and then their personality's there. So, one of the lines in the show, I mean, they talked about, one of the characters that lost their parents. And I think the daughter of the main character who was demented talked about how much more difficult it is to have the person still there, yet they're not there, So that was depicting the intricacies of the relationships and how different people, based upon sort of where they were coming from their base, dealt with the difficulty that was central to the play. The other thing that I thought was just so powerful that Domingo does is he creates an exercise, or gives an example of an exercise that would be very helpful to families to sort of understand the perspective of someone who's dementing. I'm not going to give that away, but it's hard to place yourself in the shoes of a person who's dementing if you've never been in that situation, obviously. So in terms of the best advice I could give to families, I would say learn as much as you can, like through talkbacks, talking to professionals. There are support groups. Learn as much as you can about the illness itself and the particular form illness that your loved one has, so that you can try to get some sense of what it is that they're experiencing, what their reality is, and seek out as much support as you can. The daughter who was the main caretaker was completely burning out and not getting at all what she needed from other family members. Families need to sit down, as they ultimately did. Families need to talk about sort of, there are a lot of steps. A lot of people, especially in the African American community, will not, even talk about, nursing homes or anything like that, because that's not what we do. We try to take care of families at home whenever possible, family members at home whenever possible. But there's a whole spectrum of services before one gets to making the final decision of putting someone in a nursing home. So you have a lot of options, but you have to talk to the professionals, and you have to not be afraid to consider all of the spectrum of options.
Yes.
So that would be my advice. Mm-hmm.
Thank you. I think that's key. Burnout is real. I think we're all living in a time where we understand what burnout is. We're still living in this post-lockdown world, and burnout is affecting everyone differently. And we do see that in Shelley. Like, it's very clear that she is burned out, and her working through it takes a moment. But I love your advice, to not be afraid to sit down and have those conversations and talk to the professionals and how you handle this, because it is culturally different for different cultures and how we care for our family members. Sonja,
just another point, underline what you're saying. It's important in those situations to not only take care of the person that's dementing, but to take care of the people who are the caretakers.
Yes.
And that's just as important, and that's often missed.
Yes, 100%. And we'll share, if you're listening to this, we'll have some caretaker resources that we'll share so that you have some things if you are in that situation or know someone who is in the caretaker position. We want to make sure we share as many resources as we can, because one of our big important missions at 3Bone is when you leave the theater, we don't want that conversation to end there. We never want you to leave and be like, well, that was great. And then you go home. We want to carry on the conversations, even past this talk back, because I think we all can agree, one of us, all of us, has identified with one or more of the Sheely characters. So I'm going to throw it out to each of you, Robin and Sonja. I'm going to ask you guys, and then I'll come back to you. Which Sheely character did you identify with the most?
So, if I may, again, and I too want to thank the Rebone Theater for inviting me to be a part of this talkback, as well as the community partnership. It has just been a very rich experience thus far, and I'm looking forward to our continued engagement with one another. So your question around which character. So I'm all over the place. So as I sat in the theater, I could relate to every character on stage. Every character, and I don't know that that's ever happened at any performance before. For me, I could relate to every character, and if I don't know where your questions are going to lead us, but if I may, it was like stepping into my family's living room, or my mom and dad's last home, if you will. So, just briefly, my mom and my stepdad were both having some health issues in the last 2 years of their lives. And my brother Lionel, my baby brother, Harold, was the primary caregiver. He lived in the home with them. He took them to doctor's appointments, and he went grocery shopping, and he picked up medications, and he was in the mix. He was in the thick of it. We have 5 siblings, and he reached out to each of us for different things at different times. And some of those calls, with me being long distance, because they live in the DC area, with me being long distance, I could tell the burnout. So he was the Shelley in the play, if you will. Mm-hmm. And when I tell you, there were so many different different layers where I saw my family. It brought me to tears at one point probably at 2 points, but definitely at one point. If I had to choose one, I probably would choose Donnie. And perhaps because as an out gay woman, I could relate to the relationship challenges that were going on in the play, and being kind of long distance away from the center of the family. So I truly could relate to that.
Thank you. It's good to know you feel like stepping back in. I think that's the beauty of this show when we're looking at these family dynamics. There is something very familiar about walking into the Sheely's house and having been there. And even if you aren't Shelley, you're Donnie, you're the long distance sibling who is trying to plug in where you can, but also you're not there, and hearing your sibling who is there and experiencing it is a different world, and navigating your own relationships while you're far away. So thank you for sharing that. I think that's good to know. Robin, we had a little side conversation the other day about characters. But I didn't ask you which one, when you walk in, were you?
I don't know. I mean, I think it's kind of hard to pick just one, sort of like Sonja was saying, there's parts of all of the different characters that feel really resonant. I mean, with Tiffany, we've talked about, I think Shelley, wanting to sort of figure out her overwhelm by controlling the situation, I think is something that definitely resonates. I think, that definitely hit home for me. But there's, for all of them, I think there's such palpable characteristics. And one of the things that I love about a lot of the shows we do is that people relate to them, but this show has truly surprised me, just like the amount of people afterwards who say, this is my family.
Mhm.
Like, regardless of their background, regardless of their experience, like, you know, and they come in and say, I just witnessed my family on stage, and people really feel that, you know, we're parts of that. And that's been so rewarding. And I think speaks, you know, volumes about Corey's direction and the cast and Colman's writing. I think just coming together beautifully to tell that story. So
Yes, I will say this is watching from the lobby as people depart. This was a show where that is a different experience. We often put on things that are great and people leaving, oh, that's great. But this one, I've heard more and more things about people's lives post-show. Even some people I know, like I've ran into some people who have then said, you know, I dealt with X, Y, and Z because this particular show brought it up in the conversation. So it's one of those shows. I'll stay in every show we do, but this particular show with family and dynamics and what's going on in the world, I think the world we live in now has a lot to do with family dynamics and caretaking, because when we went into lockdown, we all had to navigate what that looked like for different family units and what that looked like as far as care models for different family members. And even in that, you can relate to each and every one of these and how you handled that. For me, I'm very young parents, but my grandmother is very close. So we had to figure out who has eyes on, who is making sure food is delivered, who is making sure and spreading the wealth. Because listen, I got some Shelley tendencies too, but I'm also the older sibling. So that's a natural inclination. But I also have some Avery tendencies where you're just like, I'm here to make this parent happy, period. You may think it's goofy, you may think it's silly, but I'm gonna make my mama happy because she deserves it, right? So I think you brought up a good point that everyone's relatable in this show, and you have a moment where you're like, huh. So I want to ask you a little bit. So your center deals with African-American community, LGBTQ plus community specifically, and getting them access to things they don't normally have access to, which I think is important when we talk about this play too. So I'd love to for you to tell the audience a little more about when you looked into a need to fill as a community org, when you identified that these were the communities you needed to be in, and that you needed to provide the resources for them to get the assistance they needed, how that came about.
Sure. So as you can see from the name of the organization, Lionel Lee Jr. Center for Wellness, Lionel Lee Jr. is my big brother. He was here when I got here. When I got to the planet, he was here. And in 2005, suddenly he was not. He had a tear in his aorta, and he was experiencing chest pains. He went to his HMO, which was the place where he had to go for healthcare coverage. And he went to his HMO, and they looked him over and they sent him home. And as he was driving back to his home, he turned around because the pain increased. And he got back to the HMO, but he never made it inside. He died in this vehicle. So that whole situation, the grief and the pain of that was the catalyst for forming the organization. I never want to see anyone go through a situation like that, because they are channeled, if you will, into one particular resource or no resource whatsoever. So the organization was founded to help me, first of all, but really in the spirit of my brother Lionel. He was such a giving and generous person. He was such a loving spirit. He would give you his shirt off his back. He was just that person. So our organization was formed to support people most in need, people with chronic illnesses, people in underserved communities, to assist them with getting the help that they need. That could be physical, it could be mental health, whatever the area is. And in most cases, the people that we serve are people who have new diagnoses, um, financial challenges. As we all know, medication can be very expensive, and we assist those people with getting connected with the resources that will sustain them. The initial outlay for the initial medication, we assist with financially. And I just thank God for our donors that have make those donations without without any strings attached, so to speak. I don't have to do invoices and monthly reports. These are just people who, from the generosity of the spirit, will support our brothers and sisters that need assistance. We also, along the way, as we have evolved, we received our 501c3 in 2008. We do education and awareness in community. We host events such as wellness retreats, where people can get out, get exercise, and meetings in the kitchen where we do healthy cooking, and we have speakers come in, facilitators to come in and lead dance routines. So we do a number of things to get people moving and raise awareness around chronic illnesses that affect our community.
Thank you. Thank you very much. Thank you, one, for sharing your story of your big brother. And I love that you use that to make sure that no one else would go through that. But that brought up something that Dr. Logan, I think they kind of match. So Dr. Logan, earlier you talked about we culturally, people of color have a tendency to want to care at home. And we know statistically there's a medical bias in our communities. Do you think that medical bias and the stats we know around the treatment of Black and Brown patients is what leads to the reluctance in us finding our pathway to professionals in care? And do we think, specifically in this show, we see that Shelly's solution isn't a certified actual caregiver. She just finds a guy who would be good at this, right? The guy to give her peas. And so I'm wondering, as we dive into all these barriers that people have, do you think that's one of the reasons culturally we don't reach out or we don't get to the professionals like we need to?
Absolutely. Absolutely. First of all, I want to say to Ms. Lee, I want to second, what you're saying, Tiffany. What a beautiful example of, turning your pain and your loss into something not only just to help yourself, but to help others. I think that's a beautiful story. In answer to what you're saying, absolutely, Tiffany. And there are real reasons why certain communities don't trust the medical system, because there was a time in our history where we either did not have access, we were turned away, or everyone I'm sure is aware of the Tuskegee study that went on in Alabama. I actually myself found out just about 5 years ago from my aunt. I realized that my mother never talked about her father. I met her mother and all that kind of stuff, and she just never talked about it. We never thought anything about it. But I found out just 5 years ago from my aunt, my mother's passed away now, that my grandfather was a part of that study, actually. So, and for those who don't know, it's a study that they did. I think it started maybe in the 40s and 50s, but went all the way through to the early 70s before it was stopped. It was considered, before it was determined to be unethical, which it was, but they got a group of men together. We're in theater here, so if you want to watch a dramatic version of it, you can sort of look at the movie Miss Evers' Boys that stars Alfre Woodard. And it sort of tells a story better than I'm sure I'm going to tell it here. But it got very trusting African American men who were suffering from syphilis. They told them they were entering into a study where they would receive treatment for the syphilis, when in fact, the purpose of the study, the real purpose of the study, was to study the natural course of the disease, meaning that they would not treat it, even though they thought they were in treatment. The physicians involved in the program and the program developers determined to not treat the syphilis so that they could watch how it evolved in people as they aged if it went untreated. And syphilis is a very, it's a horrible illness to have untreated. We obviously have medications to treat it, so it was just really terrible what they did. And, you know, it leads to dementia, delirium, you know, that sort of thing. So without getting too far into that particular situation, there are a lot of situations like that that have occurred not only in the African American community, but other communities as well, that definitely has caused mistrust with the medical community and you know, anything to do with the government in general. So one has to understand that. I'm sure, Ms. Lee, you have dealt with that. That's part of the work that you have to address when your patients come in to see you.
Yes, if I may, trust is huge. Trust issues are huge. And you mentioned Tuskegee, and I have an uncle on my dad's side who was part of that whole situation. And I just found this out in the last 2 years, maybe, just hearing my dad, who is in his early 90s now, my birth father, share that story with the family. And that is a story that he did not feel comfortable sharing until very recently. So, so sometimes those situations go unknown. And I thank you for mentioning that today, Dr. Logan. And I thank you for working community. I will also want to add the other barriers around not just mistrust. There are literacy issues as well as tech issues that prevent many people from accessing resources that are low cost, no cost. Sometimes it's just, I don't know how to fill out the form. It's shocking how often I have heard that since we began doing our work in community. I don't know how to fill out the form. I can't fill out the form on my cell phone. I don't have a computer. I can't fill out the form on my cell phone. Will you help me? Sometimes it's as simple as that.
Just resources in general. I think that's a great point. You know, having transportation, you know, to get to appointments, and, you know, and as a caregiver, you know, I could see people getting frustrated with people not making appointments, people being late to appointments. But it's important to understand, you know, that there are oftentimes reasons other than someone just being irresponsible.
Yes. And I'm so glad both of you brought that up as we are looking at this show. If there was an audience member who thought to themselves, I don't know why she just didn't, you know, I don't know why she just didn't get her extra help. Or I don't know why they didn't hire a nurse. I don't know why they just didn't put her in a facility. It's not that simple. I think the key to what both of you are saying, culturally, there is a large distrust. You know, I'm a youngish woman, but I have a general mistrust of the medical teams because even before, you know, now, maybe a month ago, I went to a doctor and said, this is an issue. And they were like, no, it's not, it's this. And I was like, I know my body. This is an issue. But I think it brings up a lot in this show. And maybe we see why Shelley is just so overwhelmed, because sometimes it is simple as not knowing where to start. Or is there somewhere that I can trust? Is there somewhere I can get my mom to? Because Shelley is also navigating single motherhood by choice, but she is navigating that in her battle to get what she needs for herself and for her mom. And right now, the weight of the mom is very serious. So I'm glad you both mentioned that history in the medical world and how it plays into our current lives, because this play wasn't set that long ago, right? We're not in 1963 for this script. We're in 2013, Robin, am I correct? Yeah, we're in 2013 in this script. So we think so many things are so long ago. If you have not found information, heed Dr. Logan's recommendation, do watch Miss Evers' Boys or do some research. Because I think when we're looking at shows like this and trying to understand, if you're not in this community, some of the choices these characters made, that's a great place to go. Now, I promised our speakers I wouldn't keep them that long. I really just wanted to dive into some themes and then get some opinions.
That I have to make sort of to go to
go
the
ahead.
other side as a physician. You know, I think it's important for people to understand too that medicine is not perfect, and there will be things that we miss, and that does not mean that we don't care or you know, I mean, I can remember growing up hearing people say that, you know, when they cut into you, that's when you get cancer, you know, you get sick when you go to the hospital, you know, that sort of thing, when in fact it's by not going to the hospital that causes you to be so full of cancer by the time you actually get there. Whereas if you'd gone there earlier, you know, so, you know, not all clinicians, not all patients are perfect, but what's important is to try to, as best you can with your treatment provider, to develop some level of communication. You don't always have to agree. I tell my patients all the time, we can agree to disagree, you know, and you are in charge of your treatment. You ultimately determine how your treatment will go. But you have to sort of allow the expertise of your treatment provider to come in and use that, find a way to use that appropriately to your advantage.
Yes, I will also agree that is key. And again, we want to make sure past this conversation, you have resources to help you along with that. So we at 3Bone will include resources. So you have trusted places to go, trusted people to talk to. We have community organizations like Sonja. So you're not out here figuring it out by yourself. So if you or someone you know is going through something similar to any of these characters or something different, but you need to find space to know where to go to navigate, we will get you the links for all of that. We will also make sure we have caregiver links, because as Dr. Logan says, on top of the patient and the person experiencing something, the caregivers themselves must be taken care of. So we will make sure that is included.
Piggyback on, I'm sorry to.
No, go ahead, Dr. Logan.
Sort of on, you know, what you're saying. You know, sometimes you have to go to the hospital. Sometimes you're limited. You don't have, you know, resources other than, you know, places where you're uncomfortable going. So if you're in a setting like that, which is maybe not a setting of your choice or preference, even in those settings, there are sort of the majority of times ways for you to appropriately communicate your discomfort or your difficulties that you've had in the system. And, you know, so keep that in mind. If you go to the hospital and you have difficulty, you know, there are usually patient liaisons, patient administrators that are on call 24/7 at most viable, you know, treatment centers that you can talk to appropriately. You know, if you have something that doesn't go as you think it should, appropriately, I need to emphasize. So
thank you for emphasizing that. I think people need to know. And the more you know, the more you're able to advocate for yourself, the more you are less likely to go, can't go back there because it was horrible that one time. Listen, I'll write a strongly worded email in 2 seconds. But that is a learned trait, to advocate for myself. And we know that that is an important thing to cultivate. And even in the play, it took a long time for Shirley to say what she actually needed and not to demand, I demand this is what my siblings do versus what we need to do, right? You're laughing, Sonja, because it's true. And it's a
Well, and
conversation.
I love when Shelly's like, you guys are finally getting it. And Avery's like, well, like, yes and no. Like, I'm talking about us sitting down and having this conversation.
Yes.
Right. That like, yes, we need to have this, but we need to have it in a way that is
Together.
actionable and together and
Yes.
calm and rational. And, I always enjoy that moment.
It is. It's the perfect for me, because it's like, for so long in this show, Shelly's like, I'm right. My siblings need to get it together. That, that her siblings are like, I can imagine phone calls between Avery and Donnie on the back end that are just like, if you don't get your sister, sister, because they are, she's just demanding, and that's not how we solve things. So I want to thank you guys. Thank you, Dr. Logan, and thank you, Sonja, for joining us. Thank you for coming to see the show. Thank you for lending your expertise in the discussion about the themes of the show and what's going on. We truly, truly appreciate you. This conversation will live on past today and past this run of the show, and we will include resources so that everyone, number one, is aware of who you are at your practice. Dr. Logan will include, Sonja will include your org, and then we'll include some other resources that we have so that the conversation doesn't stop here. It never stops here. So again, we at 3Bone thank each and every one of you for tuning in today. We will be back with our next show in August, which is Tony Stone, and we can't wait to talk to you more.